Hi, I'm Dr. Hussein Musa,
Hi, I'm Dr. Adatone Musa.
and this is Healing Talks with the Kingdom Docs.
I'm a board-certified neurologist.
I'm a board-certified anesthesiologist, pain doctor, and addiction medicine specialist, and I'm also the father of 3 boys, and my children are surviving childhood, and I think that's a huge accomplishment.
Why so many titles?
Well, it's really important. The last one is most important because I have this theory that boys they have to develop this block they have to develop a gateway between thought and action. Like boys, they have
No bad ideas?
There's no bad ideas. They have no
Yeah.
bad ideas.
Yeah. Well, you definitely deserve another certification or degree for that. For
I do.
For being the excellent father that you are.
Yes. Why, thank you.
Anyway, today we're going to address gaps in healthcare and how direct care can help to fill those gaps. And as a neurologist, I've witnessed and seen a lot of gaps in healthcare because of just systemic issues with our healthcare system. A lot of times it has to do with lack of access to the doctor. It can be even more challenging for a patient to access a doctor when they are a specialist. And so we'll delve more into the neurology population. And I've cared for a lot of patients who have syndromes from birth to adulthood that can cause intellectual disability. It can cause all sorts of disability and also seizures and epilepsy.
That sounds like a lot. So
Yeah.
these patients, they typically follow their neurologist almost for most of their life.
Yeah, pretty much lifetime. And a lot of these patients will start off, obviously, seeing a pediatrician. Maybe this patient experienced a birth injury, for instance, and now it has caused some issues with brain development, and as a result, they have seizures. Okay, so they'll need to see a pediatrician. They'll likely have a pediatric neurologist. But what happens when that patient is approaching adulthood, or maybe around age 18, 20, 21, 22?
Now, for these patients, I'm imagining especially if there's some sort of developmental delay, they're going to be taken care of by a family member. They're going to have some level of caretaker or probably more involvement by their parents than a traditional patient.
Yes, absolutely. A lot of these patients have caregivers. They can't make their own decisions. And the caregivers are actually very knowledgeable about all of their medical problems. They're very, very conscientious mothers, parents, and fathers. Typically, in my experience, they come to the clinic with a big binder of information just about their son, just about their daughter, about their medications, about their, side effects and allergies, all sorts of things.
I can only imagine the amount of medical knowledge that the family members would have, and during that transition of care, what it would be like to go in and see an adult neurologist after having that bond with your pediatric neurologist for years. But not only that bond, that binder of paperwork.
Yeah, my heart goes out to the moms and the dads out there and the caregivers of these patients, because they have been through it all with the patient, and it can be kind of scary and just uncertain when you're trying to transition from peds to adult. And to find an adult neurologist is really difficult, and they may have to wait for a long period of time until they get someone.
Now, if they're going to see an adult neurologist, I'm assuming they're getting right back into that specialty healthcare problem where it takes time. And the neurologist, once you see them, do they have an hour, or in this case, like 2 hours to
really delve into it? No. And so that is what we offer in direct care, is very fast access for these patients and also frequent access.
Well, that's all the time we have today. Thank you for joining us. Visit us at kingdomdocs.com.
Bye-bye.